So it would seem then that if we're looking at the fact that in that room that you talked about of 90-year-old men, that most of them have it, this would not be genetic then. This would just seem to be something that has happened through evolution more than genetics of an individual strain of human beings.
Yes and no. We also know that there is prostate cancer does carry a genetic link. If a man has a family history, and we're talking about somebody whose father, grandfather, maybe uncle developed prostate cancer when they were young, 50, 60. And I know young is a relative term, but we're talking about earlier on in life, not when, my grandfather was diagnosed with prostate cancer at 90 years old. He ultimately ended up passing away of a heart attack or something else. That really isn't considered a family history because, as I said, as you get older, the incidence goes up. But if you do have a family history of it, there is a higher likelihood that you may develop it, and that's where the genetic link does exist. So to answer your question, it's yes and no.
So you should have a genetic test.
There is no genetic test. No, we're not talking about the same way breast cancer. We know we have very good genetic tests that we can perform if a woman has a very high family history of certain cancers. When it comes to prostate cancer, it's a matter of actually walking in to your urologist or your primary care's office and having the appropriate tests.